Well, good afternoon, and we want to welcome each one of you that have joined us today for the 107th week of the Flint Community Webinar on coronavirus. Today, April 1st, marks a very, very important day, and we're so thankful that you all have joined us. For those of you that may have joined us for the first time, you may not have heard us say that this webinar is brought to you by the Healthy Flint Research Coordinating Center. It's a founding organization for the webinars, the Flint Center for Health Equity Solutions, and the Michigan Prevention Research Center. Again, we're so excited that you joined us today, and we have got some incredible information for you. I'm excited to be your moderator, Yvonne Lewis, one of the co-directors of the Healthy Flint Research Coordinating Center, representing the community, along with the other partners that you've heard us talk about for the Healthy Flint Research Coordinating Center, the academic partners from Michigan State University, the University of Michigan, both Flint and Ann Arbor campuses. We have this broad array of community partners, community-based organizations that have been a part of this from its inception. We also have had Genesee County Health Department, McLaren, Flint, Hamilton Community Health Network, the Valley Area Agency on Aging, Genesee Health Plan, MTA, Wayne State University, the Flint Community Schools, along with GISD, the Greater Flint Health Coalition, the Community Foundation of Greater Flint, and the list goes on. Over 45 partners have joined us every week, and I am so thankful for the commitment that they have made to help us bring a local context to this global pandemic, the coronavirus. And today is no different. We're going to bring to you some very, very important information. Hopefully will help you to find ways and better understand ways to, I'll say, to understand this virus, to understand all of the resources, what we know, what we don't know, the research factor we're going to talk about today, because research is still underway. You've heard us talk for the last 2 years that we're all a part of a research experience. Corona is new to us. We've never, not Corona, but this particular strain, the COVID-19, is new to us. And so we're learning so much as we go. And we appreciate everyone that's been a part of helping us get a better understanding of this. Today, we'll also have a medical moment. We'll hear some updates from the city of Flint, and we're going to, again, talk to you about the opportunities that are available for us through our health department to get testing, to get vaccines, and other relevant information. These are trusted voices, and I hope that's been important to you, with credible messages, ones that we can understand. And I want to tell you about the dependable partnership. I'm going to let you know how incredible our partners are as we talk today. We want to start this webinar today acknowledging that it is my National Minority Health Month, and the theme is Give Your Community a Boost. We understand, and it's quite sobering as we look in the popular media today, that we're seeing less and less about Corona. You'll see it flying around on the bottom of our screens, and maybe an item or two in the news series. But we've always talked about here in this community how important it is for us to address all health factors. So National Minority Health Month, their theme is Give Your Community a Boost. We're talking about all immunizations, but we're also talking about, from our perspective, elevating the equity conversation as we think about minority health. This month also, we're going to be looking at another important issue that many people may not be aware of, but this is World Autism Awareness. Tomorrow is World Autism Awareness Day, and there will be activities around autism awareness during the month of April. I was just recently came to understand that 1 in 144 children are diagnosed now with autism. Very, very important for us to understand. There's a spectrum of levels, I will say it that way, levels of autism. And it's very important to support those individuals who have, those families that have children who have been affected by autism. In addition to that, we're going to give you an update on some really, really important data from our own community. So let's jump right into our conversation today. And I want to welcome Dr. Deborah Farhold. Dr. Deborah Farhold, thank you for joining us today. As we know, she is the Associate Dean of Public Health Integration and a CS Dowd Professor of Public Health. And Doctor, I had an opportunity to talk to some folks, and I said, even before your feet hit the ground as a full endowed professor, you were already writing grants to help Michigan, help Flint look at equity. And that was the growth, the development of the Flint Center for Health Equity Solutions. And one of the things that Dr. Deborah Farhold said, we want to be at the forefront of the health equity solution. And so Dr. Deborah, want to just talk to you a little bit about what that has meant and welcome you today, because now, Dr. Deborah, can I see your face? There you are, Dr. Deborah. Dr. Deborah Farhold, you have done so much in this community. Just to think, in these last few years, you've been on the coronavirus task force, and you were bound and determined to make health equity and elevate health equity in these conversations. So I just want you to talk to us a little bit about that. And then I don't want you to give away, I'm going to talk about a secret in a minute. So I don't want you to say that right now. I just want you to talk about the importance of health equity, and particularly as it relates to coronavirus.
Yeah, so, we have language that's been emerging and evolving. It was actually a British guy named Sir Michael Marmot who first coined the term the social determinants of health. And what he was offering was that there are things outside of the individual that will shape and influence their health and their health behaviors and their opportunities for optimal health. And that those things could be as important, if not more important, than their individual behaviors or even their genetics. And our good buddy Daniel Dawes added to that, and he's termed the social and political determinants of health. And we've definitely seen during COVID that politics and politicians in the political landscape are also very important drivers of resources and health outcomes, right? It was politics and political meddling that got in the way of, I think, a very robust response and a better mitigation response to this pandemic. And so I've really worked really hard to try to make sure that people, one, have the language of health equity there. I'm surprised there's so many people, even in the health sector, who still don't believe that health disparities are real.
Yes.
And when you talk about health disparities, they immediately, like, their minds can't help but immediately go to individual level factors and blaming the person. Well, they won't eat right. And it's like, well, they live in a place where they don't have ready access to high quality, healthy food, and the food that they have access to that's high quality and healthy is at a price point that they can't afford.
Right.
But it's so hard for people to wrap their heads around that not everything about somebody's health and health behavior is their own fault.
Mm-hmm.
We learned during the Flint water crisis, kids are born into poverty. If you had a choice right before you were born to pick what you would be born into, would anybody choose poverty? Of course not. I'd want to live like the Fresh Prince of Bel-Air. And
exactly.
With, a butler and a pool and all of that. And so we just know that there are things about systems and structures and how our society is set up and policies that are important drivers of health outcomes. Those are the inequities, the upstream factors, the systematic things that unfortunately are baked into our society that we know are as important, if not more important, drivers of people's health sometimes than their individual level behaviors. And that's not to let anybody off the hook. I tell people all the time, it's important that you still take control of and do what's in your hands. Right.
And as our resident epidemiologist, you've also told us we've got to watch the trends. And so you talk to us about how important research is. And that's always been a touchy subject. But research and this data is really, really important, because had you not pointed that out, we would never have the distinction in Michigan as being one of the first states to reduce the disparity in African-American deaths. Or, so you can explain that better.
Yeah, we are the only state that I know of that eliminated the racial disparities gap in COVID cases and deaths. And I believe why we were so successful is because, one, we transparently reported on those disparities. At the outset of the pandemic, African Americans represent 14% of Michigan's population, but represented 41% of COVID deaths. It took us about 5-6 months, but more than three times overrepresented in deaths. It took us about 5-6 months. But we completely eliminated that disparities gap, and that gap has remained closed. Very similar trends that we saw in Genesee County, right? African Americans much more overrepresented. And the reason I think research is important is because if we only deal with what's on the surface and don't start to unpack and really address what we call, and Sir Michael Marmot called, the causes of the causes.
Oh, okay.
He calls it the causes of the causes. So if a poor diet is the cause for your obesity, what causes you to have such a poor diet? And again, it's hard for most people to wrap their heads around. It's more than just people don't have the knowledge or the education. Some people really physically don't have the money. Some people
Exactly.
don't have transportation, and the grocery store is too far. The nearest grocery store is too far, or it's too expensive. So yeah, so the data is important, the research is important, and that doesn't let us off the hook for some things we know, and we have to do better at just addressing them, and then making sure that the level of the solution matches the level of the problem.
Right. So now, Dr. Deborah, you have been, we talked about this and we laugh about it a lot, but you have been up early in the morning on radio programs. You've been on podcasts. You've done streaming lives all over the place, all over the nation, talking about this global issue, giving it some local context, helping people understand. And so I am so excited for you, because you're now sitting in a different place with us today. And I know people have heard it, but I am wanting to just share on our webinar today that you are going to be the dean of new NYU School of Global Public Health beginning July 1, 2022. Our own Dr. Deborah Farhold, right here from Flint, Michigan, because being at the forefront of this health equity solution, you've alerted people across this nation, and they tapped you.
They did. It's I always say equity is the weakest muscle in our nation. We espouse it as a value, but we don't really know what it means, and we haven't done the best job at figuring out how to get it baked in. So myself and others, you too, Yvonne, you're my partner in everything, have just worked in that. And I love Flint. I really do. And I love the work that I do with community as an academic partner. And I think about what would be possible doing that work all across the globe, really solidifying the power and the possibility of strong community academic partnerships, and being able to take this work and what I've learned and who I've become in Flint and scaling it up to the global stage is really, really exciting. I'm humbled by it. I always tell people, all y'all need to put on your resumes, we make deans, because Lord knows being in Flint has sharpened me in ways that I wasn't ready for. I came here thinking I had a lot of stuff figured out, and I got humbled real fast and learned a lot more, and I'm better and I'm stronger for having been here. So I thank my Flint community, and I might be leaving physically, but y'all aren't done with me. More to come. More to come. So I will just say until I see you next time.
Well, yeah, you're not gone yet. So you're visiting in New York right now, but you're going to be back here helping us to complete some work and to expand some work. I just want our community to know, when we talk about some of the opportunities that community-based organizations have had to get funding, Dr. Deborah Farhold in the background, some of you may not ever have known this, but she worked with our community foundation. She worked with the United Way. She worked with the Greater Flint Health Coalition, the City of Flint, the Michigan Public Health Institute, and some partners nationally to get dollars disseminated directly to community-based organizations to help do this work. So on behalf of all of us, Dr. Deborah, we want to say thank you. We'll probably be saying thank you for a long time, because when we look at the impact that we've been able to make, the data dashboard as an example, one way, and we're going to talk about this data in just a moment, one way we're able to look at these numbers and help give some understanding. So again, let me just say, I know if everybody was in the room and they'll put their thank yous and put hand claps and all of that in the chat. And for those of you that are on Facebook, send up some hearts, because we owe a great debt of appreciation to this young lady who came here during the water crisis and helped us stand up all of this great work. The beauty of it, Dr. Deborah, is that you've put it in place so it doesn't go away, because you have to just walk across some different waters for a little while. So thank you for that. And so help us understand where we are right now with this race data.
Yeah, so we continue to have some problems. They're I would say less than trivial, but with some missing data around race. And this is just, it's so unfortunate. And I do think it's preventable. One thing we have done, I think, is figured out where a lot of the gap is occurring is in between the person who fills out the information, whether that be the person administering the test or the person who's taking the test, and what the lab then reports back to the state. And so we got to keep doing better with that. But we do look, and we look once a month at the data to see where the cases are distributed. And it doesn't look like, you know, African Americans or minorities are overrepresented in the unknown race categories. So Flint is pretty holding pretty strong, pretty stable, pretty low. And we talk about confirmed cases because there's this other category, which is called probable cases. And then we'll have next week what we call lag cases. And those will be cases that they're active cases right now, but we won't know about them until next week. So if we compare what we knew were confirmed cases last week to what we know are confirmed cases this week, the numbers have gone up in Genesee County. And I do give people sort of a quick caution. We knew that this new subvariant of Omicron would be creeping up in our community. And that, you know, what the sort of prediction has been is it would be cause an uptick, maybe not quite to the extent that we've seen with some of the previous surges, but I just encourage people still stay the course. You know, when you're going out, if you're outdoors, that's fine. If you're going in indoor spaces, even if you're not required to wear a mask, there's nothing that prohibits you from wearing one. And if I were people, I would avoid crowded indoor spaces. And if I had to be in one, I would absolutely be masked and continue to practice that good hand hygiene. Keeping your hands clean. I actually think the hands are probably the biggest vector. We talk about people breathing COVID in, but you got to think we had all these COVID cases when people had masks on. And I'm convinced it's because people were cross-contaminating their hands, touching the outside of their mask or touching surfaces, not washing their hands properly. Running them under the water real quick or going like this ain't it. You got to wash in between. You got to get the thumbs. You got to get all the way down to the wrist. You need friction. And that's about a 2-minute process. And most people don't. They wash their hands in like 10 seconds. So let's just stay the course and see if we can keep these rates from getting substantially higher. In Flint, it went from 13 confirmed to 12 confirmed. We'll have to see next week to better understand if we are in fact going to see perhaps a slight uptick.
What we're again saying is do those things that we always talk about. Dr. Ritter talk about those layers of protection. And Dr. Deborah, just keeping on this equity theme a little bit, one of the things that touted across the nation is that everybody should have access. So one of the things that was done by the federal government, and all of us know, they sent out an email, sign up to get COVID tests, you know, free in-home COVID tests. So if you couldn't go out somewhere, you could get a free in-home test. So this is another thing I want to just show here, that our community has been given an additional amount of some of those free at-home tests. And so if you need a COVID test and you cannot get out to one of our sites, which we're going to talk about in a little bit of what's available here, you can call the Greater Flint Health Coalition at 810-953-2427. That's the Greater Flint Health Coalition. And they have also given some of these to some community partners. So at some of the events coming up, you will be able to get COVID test kits to test them at home. But while we're waiting for those kits, and if you haven't already gotten them and you still need kits, be aware that you can ask for these kits, 810-953-2427, or ask some of your other community partners as you're asking for resources if they have COVID tests available. And we're asking you, please, if you test positive at home, report that to the Genesee County Health Department. That's still very critical. So we want to talk to the health department. Thank you again, Dr. Deborah. Can you just show your face one more time? I know you have to leave us today before we're done with the webinar today, but just say a one last greeting for us today, and let us tell you again how much we appreciate all the work you did, and say thank you, congratulations, and we know you won't forget about us.
Never. Who could forget about Flint? I tell people all the time, this space is special. People leave Flint, and I always tell them this: keep us in your hearts and your minds, and be an ambassador. Let people know that we're more than a city that survived the water crisis. This is a city full of really bright, strong, amazing people with a lot of pride in this city. And we also know how to solve problems. And I can only imagine what would be possible if Flint really got its fair share, because we've done a whole lot with very little. So I'm a forever in the Flint family. And I was telling somebody today, he said, I think you might be time enough for them. I said, sister, I'm hard as Flint. So just
all right. Thank you, Dr. Deborah. So our health department, let me tell you how committed our health department partners are. Sherelle Brown has been with us on many weeks. She actually came in when our former representative, Suzanne Kupel, was not able to be with us because she was out on medical leave. And Sherelle came in and just hit the ground running, and so committed that she was in a bit of a crisis situation today, and came on to say to us this morning, I didn't want to leave you in a lurch. And so what we said, we got this. But thank you, Sherelle, for that commitment, even in the midst of a family issue that you needed to take care of. We appreciate that commitment. But Joanne Herman is here. And Joanne, we want to talk a little bit about what's going on with the vaccination clinics and the testing sites. So Joanne, I know that there's been a shift. So just want to talk about this a little bit. There's been a shift because there's been a reduction in the number of individuals that are coming out. So can you talk to us a little bit about why the shift in the clinics and how that's going to work?
Excited to continue this up week. We're going to be at Our Lady of Guadalupe. We will be at Shiloh this week. This will be our first full week of offering the second booster, which is really good news. The second booster is widely available for distribution. So if it has been 4 months since your first booster shot, and you are either ages 50 years or older or immunocompromised, we are available to give you that second shot. So I'm hoping that we have a slight uptick in our volume in this upcoming week at the many locations that we are providing, not just at the health department, but throughout our community. And I'm always excited when we have people, which we did this week. Yesterday, we had people for their first dose. So I never give up. It's good to see people getting their first doses, their second doses, third, and that first booster dose. So we're readily available for any and all people. And we continue to do home visits. I know you've been pushing that. So home visits for people that are having difficulty getting out of their home. Doctors and nurses are volunteering, and we're going to the homes to provide that vaccine.
All right, so we know we're going to continue with Word of Life Church, Bethel United Methodist Church, and Macedonia. Those are still going. And at those sites, people can get both testing and vaccinations.
Right.
And so we want to continue that. And again, just as the other community sites outside of what the health department is doing is Walgreens, Hamilton, and the Rite Aid. And so again, Joanne, can you talk a little bit about why it's important for people to report those tests when they're doing their in-home tests, report those positive to the health department?
Well, we really absolutely need to track and trend where we are as a community and help us in our preparation. So getting valid information about where we really are as a community, that only helps us as people can self-report those home tests.
Right. And so again, we want to remind our listeners, for those of you that can't see this, the information is available on the both in Spanish and in English. If you call and need assistance from the health department, that number, we're just going to read it to you for those of you that are listening by phone. If you know someone that needs help and can't get out, have them call 810-344-4800 to get those additional support services from the health department. This is a way we worked hard, and we have to give great appreciation to our new health officer. And we say new, she's been here for a while now, but she came in the midst of COVID. But our health officer, Dr. Pamela Hackard, who's been with us so many times, has made sure that her staff is available and have worked hard to help get these sites set up. And Joanne, I think they pulled you out of retirement, right?
That's right. That's right.
So that's how committed our community members are, come out of retirement to help us. But you're not alone in this. The city of Flint, and Kiana, if you can just join us a bit, the city of Flint is also continuing to offer vaccine sites. They expanded their opportunities. So Kiana, if you can come on and let's just chat a little bit about what the city is doing regarding the vaccine sites, because last month we were told it was going to end on April 1st. And I looked and I said, oh, it's April 1st. But then you extended it a whole nother 30 days. So talk to us about what's happening with the mini police stations with support of the city.
Indeed, we do. Good afternoon, everybody. So we had some internal conversation. You're right. We were planning to end those vaccination clinics at the end of the month. However, after engaging with Mayor Neely, who thought it was absolutely detrimental to keep those spaces open, we decided to go ahead and move ahead and keep 2 of the stations open through April and potentially through May. So residents still have the opportunity to come into the North End mini station there at Martin Luther King and Bishop between 5 and 8 p.m. on Wednesdays, every Wednesday. And we are offering testing, vaccinations, and boosters at that site. So if any individual needs to be tested, they are welcome to come in from 5 to 8 at the mini station, and they will have the opportunity to do so. In addition, at the Dordt Mall mini station on Fridays, that's every Friday, 11 a.m. to 2 p.m., right there on that corner, we will be conducting vaccinations and boosters at the mini station. But if any of this is confusing, the best thing to do is to give us a call at 810-410-2020, and we'll be sure to answer your questions.
Now, Kiana, before we get to the other things that the city is doing, I just want to point out here too, that the mini station, the North End mini station stays open to 8 p.m. So when we look at trying to address the inequities and disparities, working with the health department, all of our community partners, we're just trying to make sure across this community, everybody has an opportunity to get access to these resources and services. So again, let's appreciate the city of Flint for that work. Now, Kiana, let me just introduce you more formally in your role as the manager of public health in the city of Flint. You talked about those sites for vaccinations, but there are other opportunities and information that you'd like to share with us from the perspective of the city of Flint.
Sure, just a couple updates to share with the community today. The one that I'm most excited about, last time I was here, I was super excited as well, is the unveiling of the McCree statue. That's happening on Monday at 2 o'clock, right in the front of City Hall by the municipality sign. As a kid growing up, knowing that I was born into a city that had its first African-American mayor, it really meant a lot. And so this has just been, I've been over the moon about this since I heard the announcement. Finally happening on Monday at 2 o'clock. So please, 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 community, come out and meet us on the lawn here in the front of City Hall and join us for the unveiling and celebration. If you've driven through downtown, you can see that the statue is there. It's covered up. We don't get to see it just yet, but Monday we finally get to lay our eyes on it. So I do hope everyone comes out.
Yeah, I just wonder if you all plan that to happen in the early days of Minority Health Awareness Month.
I think there might be something to it.
Okay, because when we talk about health, and Dr. Deborah mentioned it, and we say this often, that health is more than the absence of disease. Yeah. It's also our thinking and how we feel about it. So as you mentioned, that excitement about having an African-American mayor, it also brings to us the ability for people to say, you can be whoever you want to be. And that mental health is so important when we can get these different kinds of pictures in our mind to elevate how we feel about ourselves, which also means we take care of ourselves in a different way. So thank you for that. And what else coming from the city?
Yeah, I just want to say you hit the nail on the head there. That is absolutely on point. Thanks for that. In addition, just want to remind the community that beginning on Monday, the waste pickup will begin. That's for our yard waste. You'll put it out with your regular trash, and it will be picked up through fall. So starting on Monday, you can go ahead and set those things at the curb on your regular trash day.
Awesome. And still thinking about that public health.
It all ties in, doesn't it? Yeah, almost everything can be linked back to the health, and we certainly want to take care of our community more than anything else. Fun stuff coming up. The mayor is hosting the Easter egg hunt in person. It is back this year. It is the 20th year. So that will take place on April 16th from 11 a.m. to 1 p.m. here at City Hall. So if you have young ones, or even if you're not so young and you still love Easter egg hunts, you are invited to come out on the 16th to participate. And then just one more note. Yesterday, Mayor Neely proclaimed the day Cesar Chavez Day during the Governor Whitmer's visit to the city of Flint. And I just wanted to acknowledge that Cesar Chavez was a very important person to our country. And the Latinx community was present during that presentation. So shout out to all of those who took part in making that day possible.
Thank you so much. And I just think about that. There was, many people don't know the impact. We have a street named after Cesar Chavez right here in our community to represent that. So again, minority health awareness, this is all a part of making a difference for our collective community. So thank you, Kiana, for those insights from the city of Flint, and we'll look forward to hearing more. Many of you have talked to us about the importance of hearing these phenomenal medical moments. And today, without fail, Dr. Susan Wolford, one of the co-directors of the Healthy Flint Research Coordinating Center from the University of Michigan in Ann Arbor. She is also an associate professor for the Susan B. Meister Child Health Evaluation and Research Center. And she's in the Department of Pediatrics. So she has a passion for babies, but she has a very eloquent way of sharing difficult information about these topics. So we welcome you, Dr. Wolford, to share with us the medical moment for today. Or I should put a plural on that because it's going to be some moments today.
Thank you so much, Yvonne, for this opportunity to share a medical moment again today. And so today, I'd like to address some really sort of nuanced questions that we have about the vaccines, because it's sort of hard to know exactly what information is out there. And when we're trying to talk to people who are weighing this question as to whether they get vaccine or not, how do we answer all their questions? So I want to say up front that we can't answer all the questions because we are still learning about the results of COVID and the results of the vaccine. But I want to make it clear that most people who are studying both the vaccine and COVID, when they weigh the two things, they come out at the end saying that the vaccine is in fact the safest way to go. So let's jump in here. I want us to think about 4 types of people. And let's start off by thinking about unvaccinated people. So when we think about unvaccinated people, we have those who have a history of having had COVID, and those who have no history of having had COVID, and those who have a history of having had COVID, right? Now let's think about vaccinated people. We again have those who have no history of having had COVID and those who actually have a history of having COVID. Now you can see that we're able to look at these 4 different people because we have 2 years of data. In the beginning, first of all, we didn't have vaccines. Secondly, then we had very few people who had vaccines and or had the infection. But now we have enough of people in each of these groups to be able to talk about how well the immunity lasts or how well the immunity works in all of these different situations. So I want to show us a graph. I've tried to rebuild the graph so that we can see it more clearly. But what this is showing is hospitalizations through the period from May through November of last year. And so it goes through, and this is from California, and so it goes through a time when we had the Delta wave. And we're looking at hospitalizations. So the first group of people we're going to look at are those who are unvaccinated and have not had a history of COVID. You see that when Delta surged, their hospitalization surged, right? And so they were significantly impacted by COVID because they had not had the vaccine. Well, now let's look at a vaccinated person who had not had COVID. That person, those people, there was a slight, maybe little bit minimal increase in their hospitalizations, but not much at all. Now, tell me, which group would you want to be in? I think you want to be in that group that was vaccinated because much less likely to get hospitalized. But now, the nuance here, this is the part that I want us to pay really close attention to. I'm going to bring in lines for those who were not vaccinated, and those who were not vaccinated but had a history of COVID, and those who were vaccinated and had a history of COVID. So this important thing is about people who've had a history of COVID. When we look at their hospitalizations, we see that they were both very low, right? Now, I had to redraw those lines, but the essential part of it is that they're both about the same, are both very low. Now, so you say to yourself, well, getting COVID protects you from hospitalization about as well as the vaccine, right? So why don't we all just go out and get COVID? And here's the reason why. Because there are now studies that can tell us about the impact of COVID on our health. And there are over 50 illnesses that have been shown to occur more as a result of getting COVID, the infection. So while the infection will give some degree of protection, and we're not sure for how long, but it will give some degree of protection, it also comes with the risk of getting a host of illnesses. I just want to hone in on those. We can see that there is a risk of myocarditis, of stroke, of diabetes. And there's another recent study showing that there's a risk of diabetes. There are risks of developing sleep apnea, of depression, anxiety. There are just so many things, clots, that are shown to come as a result of COVID and be there for a long time after. Maybe only have 2 years of data to go on, but it seems to last longer than one would hope. So clearly, the risk from COVID doesn't seem to be worth taking. Whereas with the vaccine, while there are many people with lots of questions about it, people want to know whether it affects their fertility. We know that the studies say that it will not. Will it affect our DNA? The studies show that it will not. Will it affect my overall immunity? There are studies ongoing to look at that. We don't know for sure, but the evidence suggests that there isn't a significant detrimental effect to our overall immunity, but studies are still going on in that area. Will it be long-term? Will the long-term effects be safe? We believe that that is the case, but we're going to do lots more studies to see if that's the case. And how long will the immunity last? Well, that one, definitely a gazillion studies on that, because as you can tell, sometimes we've been asked to get one booster, then there's discussion of another booster. Will it be an annual shot? These are things that we don't know yet, but we know that studies are going to answer, look at that to answer that question. And will it affect my child's development as a pediatrician? You know, that's what people are very concerned about, because, and we know there's lots of concern, because children who are between 5 and 11 years of age, while they can get the vaccine, only about 25% of them have, because parents are concerned about these types of things. And there are lots of studies ongoing to be able to answer those questions. At this point, there isn't strong evidence that it has any long-lasting impact in that area either. So when we weigh the risk of getting the vaccine, which appears to be very small, while there are lots of studies going on to confirm this, versus the risk of actually getting the illness, the evidence does seem to suggest strongly that the vaccine is the safe way to go. And so when we think about developing immunity to COVID, and this argument that, oh, we should just go ahead and get COVID, it seems to me that it's like the wrong way to go about getting that immunity. And I wanted, you know, I love to do my kitchen examples. If I want to toast this slice of bread, the safest way to do that is to go ahead and put it in the controlled environment of my toaster, right? I could equally toast the bread in other ways. I could heat up my iron and do that. But I mean, the likelihood is I'll burn myself. It won't be very safe. It's disastrous. I could take a flame torch to it. I wanted to have one of those creme brulee burners, but nobody will sell the butane. Not a safe way to do that. So the safest way to get immunity to COVID is to get the vaccine. Any other way is just putting yourself at risk of many things that we don't want to suffer. So thank you so much, Yvonne, for that opportunity to share.
Well, thank you so much, Dr. Wolford. I want to ask you a couple of follow-up questions, but I want to also invite Dr. EJ, we call her affectionately Dr. EJ, to the conversation. And Dr. EJ works right here in the city of Flint at McLaren. And she just is an amazing physician here. So Dr., just as a follow-up, Dr. Wolford, you talked about the many types of research that's being done. And one of the things that we've advocated for as a part of the webinar, in order for us to maintain our integrity and credibility, and that's transparency. And so as you bring forward this conversation about the many types of research that is ongoing, you said there's more now, but this has been only 2 years. And some of the normal processes for research takes many years.
Absolutely. It's only been 2 years, but what I'm encouraged by is the amount of attention that's placed on this, the vast amount of resources that are being expended on being able to study this so that we can get answers. So if you look at the CDC website, you'll see that there are many committees that are formed just to study whether or not there is a problem with the vaccine, and of course there's studies going on about the virus itself. We have there are more people worldwide who have received this vaccine than pretty much anything else. And so we have that opportunity to gather data from those large numbers, which is why, for example, we were able to determine very early on that, oh yeah, look, there is a slight increase in that myocarditis, that inflammation in the heart, in young men 18 to 39. Others are not so much at risk, but for that group, there is this slight increase. And we could tell that because of the kind of research. Now, we know that there's a larger risk of that same condition if you actually get COVID. So you
Okay.
weigh the balance. But it's being able to identify these things by putting the resources into studying it. That's so important and so encouraging, because we are in fact doing that.
Thank you, Dr. Wolford. And I asked Dr. EJ to come on because I could see her behind the scenes just nodding her head. And I wanted our participants to see the level of agreement, because you're here and you work in the hospital here, primary care physician. Tell us how important it is with the research and in that primary physician world.
Yeah, I'm nodding along because one, I'm a foodie. And so like, I love Dr. Wolford's foodie examples. Like I'm all on board. They totally make sense to me. And in primary care, a part of what we're trying to do is make these things very transparent and easy to understand, right? When I go into my office and when I see a patient, I understand that you expect that I've done some reading, some understanding, that I've gotten the data, had some understanding of the risk and the benefits. And I think what Dr. Wolford described is really important. Nothing is without its risk, but what we're doing is trying to understand which risk is more likely and which risk is more severe, right? We take risks every day, but we've decided that certain risks are not as severe and they're not really likely. What we've come to understand is that there are some really minor risks associated with being vaccinated or the vaccine, but the risks of COVID are so much more and they're so much more severe. The piece that you asked me to kind of comment on about our evolving research and what we're coming to know is really important. There are few times when we have the opportunity to sort of learn in real time, right? And that's actively what we're doing. We are learning about a new virus that has variants, and we're learning in real time. And we have trusted messengers like Dr. Wolford who are doing the 2-3 hours at night reading and learning about the new data that's come out, new vaccines that are, whether we need a booster or not. Our job is to sort of understand that and then disseminate it to our patients, talk with our patients about the risks and the benefits. And so I understand why you might, hear all of the different recommendations come out and say, why are these things changing? I don't quite understand. And what I would offer is that there's some encouragement. You should feel sort of good that we are actively learning new things and that we are adjusting our guidelines based on what we're learning. Because the virus is changing in real time and our recommendations are changing to accommodate and to be consistent with the changes that happen with the virus.
That's one reason why I think it's so important in these conversations. And I appreciate Dr. Wolford, Dr. Deborah, Dr. Reynolds, Dr. Hackard, Dr. EJ. You come back and you help us understand that it takes a lot of work in the background. And then we're depending on you to decipher it and help us as patients understand what to do. And so we're encouraging to get this information and to ask good questions. So Dr. EJ, how do you handle it? When we get all this information and we want to come to you as doctor and say, but I read that it's supposed to work this way.
I make calls to people like Dr. Wolford and Dr. Deborah, and seriously, I go to my trusted messengers. I go to my trusted people who are in labs doing the research, and I read the data and I make sure that I understand it before I have conversations with my patients, right? And I think, we get back to that food analogy. I think we have to be able to describe things in the way that people will understand them. And so the best way to be able to describe something is to understand it thoroughly. And I empathize and I give grace to my patients, right? I am struggling, having difficulty updating and knowing the new guidelines. Why wouldn't they? Why wouldn't my patients be frustrated that there's this new guideline and not knowing when to mask or whether they need a booster shot? And I have taken that on as the thing that I love to do, is to educate my patients in the community. So that's my job. And so, a patient comes to me and is, why is this all changing? And what I do is I allow for grace, because we're all tired. We're all bombarded by a lot of information, and I meet them where they are. I try to answer their questions. I say, hey, would you be okay with talking about this? What are the questions you have? What do you want to know? what's the hardest part about this for you?
So you help us to understand the real importance of having a primary care physician that you can trust so that you can go in and ask those questions too. And so if we go back to one of the slides that Dr. Wolford showed, all of those different places in a person's body that I say COVID can show up, and I've had my personal experience with friends and family members who never had a symptom, but had one thing happen, and it later, when they got to the hospital, they were diagnosed as having COVID. And so it isn't something so unique about this virus. It isn't quite the same. And I've asked Dr. Wolford so many times, I hear this ACE2 receptors, and what does that mean? And how does it affect? So can you just tell us from a physician perspective, as patients, when we feel these different things, how we should respond to them? Because the normal ways that we thought we could identify COVID may not be the way. Maybe I should say, if I'm having some chest pains or even a pain in my side, that I should go and get it checked out rather than just figuring out my own home remedy.
I'm not sure who the question is directed to, but I will say yes. I will say you should definitely get, as a primary care physician, and particularly as a pediatrician, I tell my patients, if you have a question, please call. There is always somebody there to answer your call at any time of day or night. I've had patients call at 3 a.m. in the morning because they thought maybe their child had lice. I did wonder why they were thinking about lice at 3 o'clock in the morning, but you know what? I told them that if you have a question, you can call at any time. And I was the person taking calls. So it was my role to answer that question. And that is why we're here. And so, and in this day and age, that was back in the day when we took our own first call. Now there are nurses there to answer first calls, to give you some guidance. And if that isn't sufficient, then they can get to the doctor. There's always a resource. So I do not think that people should wrestle at home with health-related questions when they could get input from their healthcare providers. And that is what we're there for, to help work these things out. And because COVID and the way it presents is changing, we may not have all the answers either, but we can do a video visit and get as far as we can there. And if that doesn't work, then we can have you come in. So definitely, I think that this is a collaboration, and you should collaborate with your primary care providers to be able to stay in the best health possible. Because that chest pain, even if it's not COVID, could be something else that we really need to address.
100%, yeah.
Dr. EJ.
I completely agree. We have a 24/7 service after hours that answers calls very similarly. And, I've had patients call at 3 a.m. needing a refill. Well, they're going out of town. They need their refill, right? You have needs, and that is what we are here for, to serve your medical needs, to answer questions that you might have. And do not wait. If you have a question, if you're worried about something, that's what we're here for.
So I thank you, Dr. Wolford, because you gave me some language. I was trying to figure out, it's the way it presents. Mm-hmm. Yeah, so it doesn't present, COVID doesn't present for everybody in the same way. And I just want to just tease out one other little thing, again, listening to all these different conversations, that sometimes, and it goes to your point, Dr. Wolford, earlier, we may not have had any kind of symptoms about certain things that are going on in our bodies, because it takes time. Like, for instance, diabetes may take a long time to actually for somebody to see an outward presentation of diabetes. But something about COVID makes that process happen or seem to be present sooner than it may have been. So how do you explain that to a patient? That maybe it wasn't that you got COVID and you got the disease because of COVID, but maybe that was something going on before and COVID just brought it forward.
We're both about to jump in. Go ahead, Dr. EJ. Go ahead, Dr. EJ.
We're double dutching. I like this. I think we have to think about COVID as a process that, like Dr. Wolford alluded to earlier, that affects your whole body. And when you have processes that can affect your whole body, when something's happening with your whole body, it requires a lot of energy, right? Your body is working harder, your body's working to fight infection. It's not sort of diverting resources or sending resources to places where your body may have been working to keep other things in check, right? Your body might have been controlling your blood sugar, right? But now it's taking resources to fight this COVID infection that you have. Well, your blood sugar doesn't have those resources anymore. So we see what was a slight elevation as a much higher elevation. I would think of it as your body doesn't have the resources to keep at bay some of the things that might have been working under the surface. And now we've uncovered some of those things that were sort of hiding in the background, right? Blood pressure is another great example. Another great example why we should be seeing our primary care physicians, because these are things that don't necessarily show up with symptoms. We call hypertension or high blood pressure the silent killer, because you won't necessarily know or have symptoms. Diabetes is very similar. You might not necessarily know or have symptoms. When your body is working really hard to fight an infection, it's using all of its oxygen, it's using all of its resources to fight the infection, it's not doing the work it would normally do, or some of the work it would normally do. And that's why we tend to see some of those conditions show up as uncontrolled or more severe when people have a COVID infection.
Thank you. Dr. Wolford, I saw you
No,
were
I
both
agree.
there.
I
Okay.
agree wholeheartedly. I think that when our bodies are under stress, whatever that stress is, it can tip us over into something that we had a propensity to develop in any case. And I think with COVID, part of what the research is going to tell us is that what's happening, that the stress is causing us, the stress of our bodies having to deal with that is causing us to tip over into these illnesses? Or is there something about the results of COVID itself, the way in which it impacts our organs, that is bringing about an illness that possibly would not have happened otherwise? So we have to sort of watch this space and see what the research shows.
Thank you. Dr. EJ, Dr. Wolford, just any other closing remarks? Because this last question, we're still having a little bit of concern in the hospital. Some of the recommendations have been lifted. It's a little bit easier to get in. So we're encouraging people, if you have already some pre-existing conditions and you haven't been going to the hospital, I'm going to turn this over to you. What say ye, doctors? What should people be doing? Start with you, Dr. EJ.
I think this again highlights the importance of getting in with your primary care doctor so that you can be thoughtful about controlling all of your baseline conditions, right? Making sure that all of any pre-existing condition that you have can be seen in the office and taken care of in a setting that's not sort of emergent and dealing with emergencies. And you can make sure all of your chronic conditions are sort of stable. But definitely still masking, still taking your precautionary measures to keep you and others who might not have the benefit of a robust immune system or who might be at risk, keeping those people safe.
Thank you. Dr. Wolford.
So I think that we have learned a lot over the last 2 years, and we realize that this virus is waxing and waning, right? So there are periods where there's lots of it in the community and we have to be hyper vigilant. And then there are periods where there's less of it and we can be a little bit more relaxed. We have to keep up to date with that. As we've said many times, it's like a weather report. You have to keep up to date with that. And then how you respond to that is in part influenced by your own individual risk. Right? So if I have just done my hair, I am not taking much risk with rain. I am not going to get wet. So I am putting on my hat, having my umbrella, doing everything I can. If I have it on a natural day, not a big deal. So we have to know our own risk, the level of risk. If we have underlying conditions and we have to be safe, then we wear our masks. If we are in better health and and the numbers are down, then maybe when we're outdoors we don't need to, and only in really high risk situations we would. So we have to have that nuanced approach to protecting ourselves. We really have to be wise in how we approach this.
Thank you so much, because COVID is not over. You are not out of the pandemic yet. So taking those precautions are very, very important. Thank you, Dr. EJ, and thank you, Dr. Wolford. I want to pull out one of our partners, Jim Melanowski. We're talking about having a primary care physician and how important that is. And so that means having healthcare coverage. And Jim, at the health plan, we use this phrase sometimes: get it, keep it, know it, use it. And this is one of those times. So in this season, Healthcare is still very, very important. How important is the healthcare coverage conversation? And what can you say to our listeners from the perspective of the health plan?
Well, you just heard from the experts. It's a must. And we've done a nice job in our community about finding and helping people get coverage, but a lot of times people don't use it. They do care episodically, and it really, the key is to really use it and then keep it. So a lot of times there's changes, you have to re-enroll every year. And that's why there's organizations in our community like the Genesee Health Plan and other partner organizations that can help people with that. And so that's what I would just encourage. There should not be anybody in Genesee County without health insurance.
So with that health insurance, if you need some help, where are we going to call to get it? So for any kind of health coverage that you need, you can call the health plan. Jim, can you share with us that number again?
Yes, it's 810-232-7740.
Thank you so much, Jim. I knew I've got partners. I can just pull them out and make sure that information.
I'm glad I wasn't eating or anything. So
thanks so much, Jim. This has been a great, great session today. And I want to thank you all for joining us. For those of you who put questions in or comments in today, continue to share that information with us. We've got a little bit more time for those of you that have not completed the survey about the webinar. And we're going to be bringing to you information next week about the webinar. But we do want you to know, community health workers and social workers, stay on just a couple minutes now after the webinar, so that survey will pop up for you to apply for your continuing education units and your social work credits for this session. We want to thank you for coming today, and we're going to ask you to continue to like us on Facebook. You just go on and be one of our partners on Facebook. You can also subscribe to our Healthy Flint YouTube channel. That's at Healthy Flint. Just go right there and become one of our partners on the Healthy Flint YouTube. And then you can always email those questions or comments. And we have been getting those comments in from you, info@hfrcc.org. We appreciate you for that. And as always, we encourage you, if we miss something, or if you have more need for questions, give us a call at 810-835-2130. I do want to say there were some questions that came up last week. When our key panelists that are going to respond to those questions are available, we're going to get to those. So continue to join us. We will be back here next week for session 108. So we want you to join us for the Healthy Flint Research Coordinating Center next week. And we thank you for joining us today for the Flint Community Webinar on coronavirus.